the childbearing process is very overwhelming. And so part of that process is knowing what is wrong, knowing what is causing the problem, knowing that it's not you. It's not because you suddenly have no interest in your husband. It's because your hormones are fluctuating during that time. And you are giving a lot of yourself. You've given a lot of your body. You're giving more of your body as you're breastfeeding. Like I said, it suppresses hormones. And so there are ways to handle those situations to help you, such that your relationship with your husband doesn't break down because now you have children. And then as women get into that 30s, 40s, busy lives, everybody's leading a busy life. You're working a regular job, you're going to all the children's activities, their school activities. There's usually, it's like there's no time for yourself anymore. There's no time to do what you need to do or you want to do. What I tell women around that age is you have to be intentional. It's
That's
not
true.
going to happen just because you want it to happen. You're not going to suddenly have time for yourself. You're not going to wake up one day and realize, oh, I'm free all day. It's not going to happen. You have to be intentional. You have to schedule it. You have to schedule the time that you spend with the children. You have to schedule the time you spend with your husband. You have to schedule the time you spend with yourself. It has to be on your calendar. You have to make an effort to do those things. And the thing with us during that period of time where we're taking care of everybody else is that we're ignoring ourselves. So
Hmm.
we might be cooking well for everybody else, but we're not eating when they're eating, or we're not exercising because we don't have time and we have to take care of the house and we have to. And so women tend to start putting on weight during this period of time, 30s, 40s, they start putting on weight. And so then all these new things start coming up with heavier period. They're like, after I had children, my periods got heavier. Part of that is because we've put on weight.
Hmm.
you know Part of that is because we're not exercising, we don't have the time to exercise, or we're not eating like we should be eating because we're busy taking care of everybody else. So I want to just center women in that it's okay to be doing all those things, because as nurturers, that's what we want to do, but you have to be intentional
Yeah, that's
about
right.
yourself.
That's
And so when women start noticing that, the first thing to go when they start noticing that transition from that early 40s going into their mid 50s, the first thing to go is sex drive.
hmm.
The first thing to just fly out the window is that I see women who are 39, barely 40, 37, 38, barely 40, who are telling me that they have absolutely no desire to be with their husbands or their partners. And so I tell my patients' partners something. Sexual desire for a woman starts in her mind.
That's right.
Sexual desire for a woman starts in her mind. Unlike men, where it's physical. They are moved by what they see. They can get in the mood in 2 minutes, 3 minutes. For women, it's a process. And this is why God made us differently, right?
Yes,
For women, it starts in her mind. She has to feel that emotional connection with her partner.
that's right.
She has
You're
to
right.
feel respected by her partner. She has to
Hmm.
feel loved. She has
That's
to feel like she matters. She has to feel like you listen. So it might not be that you helped her today washing dishes, but you listened to what she had to say. You checked on her. I have some patients where they'll be like, this is going on. There's no desire. I don't want to be with my husband. It's creating a problem. And then I start asking questions. So, okay, what time do you go to bed? So it's like,
hmm.
oh, I'm in bed by 7 and he's not home yet.
Wow. Wow.
Or he works 3 jobs, so we don't see each other. We see each other in the morning and we so
Oh my
how how,
God.
how am I gonna work with
Oh my God.
right? And so being present, right? Being emotionally present for your spouse, for your is very important to make the woman feel the desire. Imagine a woman who's worked her regular job, comes home, taking care of the children, cleaning up the house. But and then remember, this is around that 30s hormones, 30s, 40s, where her hormones are starting to decline. And like I said, the first thing that goes is sex drive. So when I check these women's hormones, their testosterone is like low, low, low. If normal testosterone is 60, I have women who are 37, 38, their testosterone is less than 3. How is a woman whose testosterone is less than 3 supposed to do all this work, do her regular job, take care of the children, cook and clean, and have the desire for sex at the end of the day?
Hmm.
So there's some responsibility on the part of the husband
That's
to
right.
help with the emotional connection,
That's right.
right? help with the emotional connection, talk with her, meet her needs. It's important to meet her needs. Because when you're meeting her needs, you're making her feel loved. When she's feeling loved, she's connecting with you emotionally. And so when it's time to initiate sex,
Men in the
you're going to
house, I hope
smooth
you
it.
are listening. Men, I hope you are listening.
And
When
it doesn't have to be monetary. Again, there's some women, yeah, it's gifts, but it doesn't have to be monetary. It's an emotional connection that
that's
women
right.
need to
That's right.
feel to get in the mood for sex. For men, like I said, it's physical. But like I said, for those women, when they come to me and we talk about lifestyle, we talk about weights, we talk about diet, but I also check their testosterone. If their testosterone is low, then I talk to them about replacing testosterone. Now, a lot of people worry about hormones, a lot of people worry about all these kind of things, but we have safer ways to give hormones these days.
No, that's right.
And with what I do with my patients is I give it in form of bioidentical hormones. So they're from plants. They look like the ones the plants make. And so it's testosterone from plants, estrogen from plants. And these women are now the ones, they have energy again. They don't do all this work at the end of the day and are exhausted and crash. They have energy at the end of the day. They have the sexual desire. Now their testosterone is higher. They have more energy. Their metabolism is higher. They feel motivated. What happens to women as they get older is they're demotivated. All the things they want to do, they don't end up doing. Even if it's to go out and have dinner with their friends, they're just, I'm just tired. I've worked all day. I got to take care of the house. So they're not engaging, like they would when they were younger. And so what I tell patients in this time is, yes, you want to recognize, because at this point it's no longer you. At this point is your hormones. So you want to recognize it's a hormonal problem. It has a hormonal solution.
Thank,
Now there are things I do for people who don't want hormones. We talk about exercise.
thank you, doctor. Because this area you are going to, I actually want you to talk more about it. I've gained a lot from your previous message on dealing with this issue of hormonal imbalance, which
Yes.
has a lot of effect on us. And like I said, maybe I don't, I have a lot of questions in my head, but I think let's take it one by one. Please, if you are connecting us, let's see your questions in the chat. The doctor is here to answer our question. Now, I want you to talk briefly because I still want you to talk about this issue of vaginal dryness because it
Mhm.
affects sex between couples. And
Mhm.
most of the time, the blame is always on the women. Meanwhile,
Right.
the women, they are having problem because if you have vaginal dryness, you can't engage, you can't enjoy sex. So it's
Right.
one issue in marriage. But before that, how do you deal? Because I had you discuss about different ways of dealing with hormonal imbalance.
Mhm.
There are some of us that are scared of using one aspect or the other, those that have reached menopause. Please,
Yeah.
can you in the next 2-3 minutes, doctor,
Yes.
talk about that? Thank
Yes.
you.
And so, hormonal, as women get older, the ovaries are the ones that are responsible for hormones. And so the ovaries start shutting down. This is why fertility also goes down as women get older. It's harder to get pregnant, more miscarriages when women are older, because the ovaries are shutting down. So these hormones are reducing in the body: estrogen, testosterone, progesterone, um, all these things. And so what I tell those women is I check their hormone levels and I show it to them. And I'm like, these are technically the way your hormones are supposed to gradually decline, but they have physical manifestations. They have the physical manifestations in your energy level, physical manifestations in your concentration. Some women cannot concentrate at work. They're having trouble remembering things. It starts affecting their memory. This hormonal
Exactly.
imbalance makes them think maybe I
Mm-hmm.
have to retire early. Maybe I'm no
Mm-hmm.
longer good at my job. All the younger ones are going to take over my position. So it becomes a problem. And so I show them their hormone levels and I tell them one of the things we can do is we can replace these hormones, right? We can replace them. We can do it safely. If you have a good doctor that's checking your blood pressure, checking your mammogram, checking your liver enzymes, you can take hormones safely. Now, for those who don't want to take hormones, there are all these other medications that can help them, especially women who are having trouble sleeping. It can help them with sleep. It can help them. There are these home medicines called antidepressants, but they are not for depression. The dosing for antidepressants for depression might be like 150, but the dose for menopause or concentration issues, sleep issues, mood issues, can be like 75 milligrams or 37.5 milligrams. One thing we notice, women are, as they get into menopause, can become irritable. They no longer have capacity to deal with things. They get angry easily. Their family members are saying, "Is there something wrong with you? You
Hmm.
seem to be less. You seem to be more angry." I get patients like that. They tell me their husbands are telling them they're more angry. It's a hormonal problem. It's not a problem with the woman, right?
Wow.
It's a hormonal problem. Some people are they're depressed. Some people,
Hmm.
there's newfound depression when they're entering into menopause. Some people, it's this fatigue. They cannot get up in the morning to do anything. There are things we can do, lifestyle things such as exercise.
That's right.
Now, what if people don't have time to exercise? It doesn't have to be a great amount of exercise. It could just be increasing your walking. As you're increasing your walking, you're increasing your body's metabolism. It's allowing blood to flow to your brain, so you feel more alert. You are able to sleep better. And so, there are some women that those things work for, but there are some women that symptoms are so severe they need medication. My point is, I don't want you to be afraid of medication. These things have systematic causes. And so we know the systematic causes, we can address the systematic causes. And if hormones is not the right thing, then the other non-hormone medication are fine. Some people use supplements. I can't really speak to supplements because I don't know the science behind supplements. But I know the science behind the hormones, and I know the science behind the non-hormonal medication.
Thank you, doctor. There's a question here because we would like to would like you to be answering some of these questions. But
Yes.
before that question in the chat by Mr. Ogunake, does it mean that it's possible to check our hormonal level? You spoke about checking the level. I don't think I've ever. If
Yes,
we go to the
absolutely.
doctor, we can ask
Checking.
them to check the hormonal level, and that will
Yes.
show how they will treat us. Is that what you mean?
Right. So the question is, why do some women struggle with sex and some do not? Everybody's different. Everybody's different. The home life is important. Like I said at the beginning, for the woman, sex starts in the mind. She
Yes.
has to feel appreciated. She has to feel loved. She has to have an emotional connection with her husband. You
Yes.
cannot compare one woman to the other, one relationship to the other. There might be a connection, an emotional connection in this particular relationship that is not in this particular relationship. Or so that's one level. The other level is hormone levels.
That's
Is
right.
this woman can be 38 and her testosterone is 65. This woman
Hmm.
can be 38 and her testosterone is 4. They are
Hmm.
going to have different sexual desire, energy level, interest in sex, right? Now, also, this woman may have had vaginal deliveries. Vaginal deliveries affect the vagina. Vaginal deliveries cause tears and wears in the vagina. Vaginal deliveries can cause vaginal dryness. This woman might have had a C-section that did not affect the vaginal walls and the
Hmm.
vaginal environment. And so, when you're asking why do some women struggle with sex, the
Are
the
different. Okay.
experience of the woman is completely different, right? The
Mm-hmm.
home life is different, the hormone levels are different, their experiences with pregnancy
That's
is
right.
different. How they Some people after pregnancy, they start having urine leakage in
Wow.
their 30s. They start
Hmm.
having urine leakage where they cough or sneeze and they leak urine.
Hmm.
The pelvic floor is weakening. Those
Hmm.
things can affect a woman. They can cause embarrassment, can affect a woman's interest. They can start having the vagina fall out because they had a vaginal delivery,
Hmm.
right?
That's right.
So there are so many processes that a woman goes through that there needs to be communication and understanding between the woman, the husband, and the doctor to understand why these things are happening so they can come up with the best plan for both of you to thrive, for both of you to have your best relationship. Some of these things are not because the woman doesn't want to. Some of these
Yes.
things are because something is going on. Hormonal imbalance is causing her to be moody and to be depressed.
Hmm.
Hormonal imbalance is causing her to be non-motivated. Hormonal imbalance is causing her to be fatigued and tired all the time.
Hmm.
You know, I check everybody's hormones because when I show them the evidence and they recognize that, oh yes, my testosterone should be 150, but my testosterone is 60. That's why I'm tired all the time. My testosterone should be 60, but I'm really 4. That's why I have no sex drive and interest. So it's very, very important to
Doc, doctor,
have that
sorry, is it
conversation.
the same treatment if the hormonal level of a man is low too? Is it the same treatment for a man and woman? Because
Yes,
a
actually,
man
for
can have that
men,
too. Is it
yeah.
the same? Okay,
So
it's
for men, their own manifestations are fatigue and low sex drive, also
okay.
erectile dysfunction.
Erectile
Those
dysfunction.
things are drawn back to low testosterone. And so
Okay.
for men, by the time we're checking their levels, we got to make sure the prostate is fine, they don't have any heart problems, giving them testosterone can turn their lives around. I have
Talking about prostrate,
men like
does it
that.
affect sex performance? Does it affect the sex libido of a man if a man is diagnosed with prostrate?
So the
Can it
prostate
affect?
issues are different in that prostate issues are either prostate enlargement, so that they're
Okay,
not able to, they have trouble with urinating.
okay,
It's different from erectile dysfunction, where they don't have sex drive and are not able to maintain an erection or gain an erection. In those
okay.
cases, it might be, are they on blood pressure medicine? There are lots
Mm.
of things.
So
It's
there
a
are a lot
whole
of
profile.
things. Okay,
Yeah. So,
okay,
what medications are they on that might be affecting their sex drive? Is it a blood pressure medicine? Is it a heart medication? If it's none of those things, then is it a testosterone problem? And so
okay.
it depends on what is the cause. That's why I'm always saying, what is the cause, so that we can address the cause. And if at the end of the day you don't choose medication, there are lifestyle changes that we can do to help
Lifestyle
both of
changes.
you
Okay.
still have a healthy relationship.